Okay, picture this. You're in the ER and a 45-year-old man comes in. He is just doubled over. He tells you he has this sudden, really severe pain right in the pit of his stomach that feels like it's boring a hole straight through to his back. You know this is serious. So you get the labs back, you get the imaging, and yep, there it is. The CT scan is clear as day. That pancreas is swollen, it's angry. You've got your diagnosis, acute pancreatitis. But the million-dollar question, the one that's going to guide everything you do next is, why? What caused this? Salam and welcome to A Little Push, 5-minute medical mnemonics. In the next few minutes, we're going to give you the key to unlock this exact kind of mystery and figure out the why behind acute pancreatitis. All right, so how do we crack this case? We're going to use a super classic, super high-yields mnemonic. Seriously, you're going to see this everywhere, on your boards, on rounds, you name it. And that powerful tool is I get smashed. It's your mental checklist. So let's kick things off with the I. It stands for idiopathic. And, this is a really important one to remember because, honestly, sometimes you can do every test under the sun and still not find a clear cause. That happens in about 10, maybe 20% of cases. Now, before we get any deeper into the list, let's just pause and talk about the two heavy hitters, the big kahunas, right? We're talking about gallstones and ethanol. These two, they're responsible for the vast, vast majority of cases. First up, G is for gallstones. It's pretty easy to picture, right? A little stone takes a trip out of the gallbladder, gets stuck, and boom, it creates a traffic jam. All those digestive juices back up, get angry, and start irritating the pancreas. And this isn't a minor cause. We're talking anywhere from 30 to a whopping 75% of cases. And what about the other major culprit? Well, in the US, get this, around half, 50% of acute pancreatitis cases are linked back to alcohol abuse. Just let that number sink in for a second. It's a massive factor. Which brings us to E for ethanol. Alcohol. And here's the kicker. It's not just a big deal for these sudden acute attacks. It's actually the #1 cause of chronic pancreatitis too. So yeah, it's a real double whammy. All right, moving on to T for trauma. Think about a direct hit to the abdomen. The classic example they love to test you on is a handlebar injury in kids. You can just picture it, right? It can also be a complication that happens after abdominal surgery. Okay, our first S in the mnemonic stands for steroids. This is a huge reminder to always get a good medication history. You'd be surprised. Corticosteroids are a well-known, though less common, trigger. M is for mumps and other viruses. Now, mumps is the classic one everyone remembers from their textbooks, but it's not alone. You've also got Coxsackie virus, yep, the same one that causes hand, foot, and mouth disease, and even HIV can be on the list of culprits. Next, we've got A for autoimmune. Basically, this is when the body's own defense system gets confused and starts attacking the pancreas. Think of conditions like lupus or another one called polyarteritis nosa, or PAN for short. Okay, lean in for this next one because the next S is the one everyone loves to ask about. It's a total board exam classic. They say it's possibly the most commonly asked cause on rounds. And it's S for scorpion sting. No, I'm not kidding. It's super specific, too, the venom from the Titius trinitatis scorpion all the way from Trinidad. Is it common? Absolutely not. Is it high yield, gotta know it trivia for your exams? You bet it is. Sometimes the body gives you little clues on the outside for what's going on inside. Take a look at this. See those little yellowish plaques of cholesterol around the eyes? That's called xanthelasma. It's a classic signpost pointing towards high cholesterol or hyperlipidemia. And that leads us perfectly to H for hyperlipidemia and hypercalcemia. And we're not talking about slightly elevated levels here. For triglycerides, you're looking for numbers that are through the roof, usually over 1,000. High calcium in the blood can do it too. All right, our second E is for ERCP. That's a mouthful, I know. It stands for endoscopic retrograde cholangiopancreatography. It's basically a procedure where doctors use a scope to look at the ducts of the pancreas and gallbladder. And unfortunately, a major known complication is, you guessed it, pancreatitis. And to finish it off, we have D for drugs. We already hit on steroids, but the list goes on. Some other key offenders to keep on your radar include certain diuretics like thiazides, sulfa drugs, and medications like azathioprine. So there you have it, IGITG smashed. You've got your checklist,
But your job isn't done. Now for a super important clinical pearl. Once you know the why, you need to figure out how bad it is. Just how sick is this patient really?
And a great tool for that is Ranson's criteria. To make it even easier, there's a mnemonic just for the admission criteria. Remember, GA law. That's for glucose, age, LDH, AST, and white blood cells. The more of these boxes your patient checks off, the higher their mortality risk. It's that simple.
All right, we have covered a ton of ground. Think you got it? Let's put it to the test with a quick quiz. Ready?
Okay, question number 1. What are the 2 absolute most common causes, the ones we called the heavy hitters? I'll give you a few seconds.
Did you get it? It's gallstones and ethanol, or alcohol. Seriously, if you walk away remembering just 2 things from this whole list, make it those 2.
All right, next question. What's that weird, rare, but total board favorite cause we talked about?
Yep, the scorpion sting. A great little piece of medical trivia to have in your back pocket for test day.
So now you have this powerful tool in your arsenal. The next time a patient comes in with that classic abdominal pain, how will this change your approach? Think about it. Until next time, salam.